Hi everyone, my name is Samantha Sanchez, and today I'll be doing my presentation on the impact of COVID-19 on telemedicine. Um, what is telemedicine? Well, telemedicine means delivering medical care through technology when, the doctor and a patient are actually in the same place physically. It can be anything from a video call, sending scans to a specialist, or even remote monitoring with devices at home. It's mainly focused on actual like treatment and diagnosis, not just general health information. And how it works is there are three main ways that it works. Live visits, where you actually see the doctor in real time virtually. There's something called store and forward, where results like x-rays are sent and then checked later. And then there's, remote monitoring where devices at home are able to track things like blood pressure or blood sugar levels and send that information to, their provider. So, the history of telemedicine, it's actually a lot longer than most people actually think. It kind of starts, with ancient communities sharing health warnings using smoke signals and like scrolls. And then it transitioned to during the Civil War, doctors used things like telegraph in order to, ask for supplies and, send chart notes and things like that. And then in the 1960s, NASA monitored astronauts. They did monitor their vital signs while they were up in space. And then with the boom of the internet in the 90s, it really made real-time sharing possible. And then we have now where it's actually more accessible through like smartphones, wearables, and it's just become a regular staple in healthcare. When we talk about pre-COVID trends, like before COVID, telemedicine was already growing. In 2010, about 35% of hospitals used it, and then by 2017, that was up to about 76%. Insurance claims also grew more than 50% in a single year. Emergency departments used it the most, especially for like stroke and psychiatry patients. But overall, it still wasn't the norm, but it was still on the up and up. And then, and then when COVID hit, that's when telemedicine really just like exploded. Medicare, Medicaid started, actually covering visits at the same rate as, in-person ones. Um, During COVID as well, HIPAA rules were kind of relaxed so that doctors were able to use things like Zoom, Skype, and even FaceTime to check on their patients. It became overall the safest way to just do continued care. Doctors used it to also sort patients, before having to admit them in the ER. It kept chronic care going for like conditions like diabetes, heart failure, while also protecting both patients and providers, from infections. When we talk about effectiveness, research does show that it does work. Things, let's for example, for chronic diseases like stroke care, surgery follow-ups, where telemedicine has really been as effective and, pretty much the same as in-person visits. Patients were, also generally very satisfied, and many even came to prefer it because, it saved them on travel expenses and also waiting time. It also helped to cut down on unnecessary ER visits because, doctors were able to triage and really focus on, oh, did the patient really need to come in or could we do this virtually? Which again saved money and helped also reduce strain on hospitals during, that really hectic time. Now we talk about rules then versus now. During the pandemic, rules expanded very quickly. Things because of how crazy the pandemic was, it was a little more lax. So like virtual visits were being reimbursed, like office visits, co-pays were even being waived. Most patients could access their telemedicine from anywhere. But I will say since then, some of those changes have been rolled back because, again, it was kind of like a one-off just because of the pandemic. Now coverage does depend on the state. It's a lot more stricter because of the privacy rules than they were back then. So progress has been a bit uneven, and the system hasn't really fully adapted yet. Now, when we talk about the balance of telemedicine, like the pros and cons, I will say telemedicine does have a lot of benefits. It expands access to rural areas, it saves patients hours of travel, it does reduce ER crowding, and can overall just save a bunch of money on costs. Like for example, there was a Texas prison which saved hundreds of millions of dollars because they didn't have to worry about um, transporting their inmates into a hospital. Um, I will say privacy and security are the biggest concerns with this. And some physical exams just can't really be done virtually. And another con would be like older adults and like low income patients kind of do struggle with technology. I would say specifically when we think of like older adults and they're not as tech savvy. So that's con. So who gains and who faces barriers? Different groups, experience it differently. Rural patients gain access they didn't have before because they don't have to drive those long hours just to see their doctor. Um, Elderly patients like the convenience, but they also may have trouble with the tech because they're not used to doing things remotely. Like I said before, prisons did save money and they did improve safety by reducing those transports. And then we have doctors were able to be more productive because, you know, they weren't burdened with all these office visits. They were able to kind of triage things properly with using remote as well in conjunction with their in-person visits. I will say telemedicine still faces some hurdles with like licensing and payment rules, but I think for the most part, it's pretty good. In closing, I just want to say thank you guys. To me, I think COVID-19, it has proved that telemedicine works. Um, the challenge now is trying to make it permanent and more easy to use and just fair overall for everyone. If we can do that, I believe telemedicine will stay a central part of healthcare instead of just being a pandemic tool. If you guys have any questions, you're more than welcome to give me a comment and I will answer.